Hello friends, today let's discuss the topic contraindications of massage in general. Now, massage is increasingly being used as an intervention for various pain and injury conditions. There is even more concern about making sure it is an appropriate intervention for these different conditions. In addition, throughout the healthcare system, there is currently more attention being placed on reducing medical errors that leads to adverse event. Contraindications provides a basic framework for understanding when and under what circumstances a particular therapeutic intervention is appropriate for treating the patient with minimal risk of injury. Therefore, contraindication serves as a guideline to help us determine if we should institute certain precautions in treatment, withhold treatment altogether, or recommend alternative treatment that would be more appropriate. Here comes some definitions. This guidance makes use of the following terms which are defined here. First one is caution, a situation in which a massage practitioner may proceed with the treatment but will need to modify technique in the light of the client condition. For example, using lighter pressure or refraining from the use of percussion techniques. The second one, local contraindications, a situation in which a local area of the patient's body should not be massaged under any circumstances. This could be for the patient's own comfort, to avoid spreading infection, or to avoid further injury. The third one, total contraindications, a situation in which no massage at all is appropriate. This is usually for reason for the practitioner protection and safety of the patient. So here comes the contraindications to massage therapy. In first one we have skeletal system injuries. Second one, skeletal system diseases. Third one, joint problems. Fourth one, we have muscular system, that is overuse problem. The fifth one, inflammatory conditions. And sixth one is blood vessel disorder. The first one is skeletal system injuries. In this we have, first one is fractures. Fracture is breaking of bones varying from a hairline crack to compound fracture, that is complete break with bone penetrating the skin. This occurs mostly from sport injuries or vehicle accident. They can also occur in the elderly person from falls where bones are thinner and weaker. In fracture we have partial fracture, simple fracture and compound fracture. So here comes the partial fracture. Partial fracture is in which the bone is not completely broken, and simple fracture where there is a clean break does not damage surrounding tissue or skin. In compound fracture where the broken end protrude through soft tissue and the skin. Massage is locally contraindicated to massage. The rest of the body can be massaged normally. Massage other area of the body that have been overused. To compensate for this restriction, gentle massage of muscle adjacent to the fracture may be attempted once the bone is well set. And the second one is sprains. Damage to the ligaments through forceful overstretching and often involving damage to the joint. Most common sprain are the twisted ankle and the injury to the ligament of the knees, especially in sports. Damage can be chronic or acute and range from a few torn fibers to a complete tear. Sprained ligaments swell up and are painful. Muscles surrounding a sprain tighten to stabilize the joint. Ligaments have poor blood circulation, so are slow to heal. Do not attempt to massage in acute injuries. After the acute stage has subsided, drainage strokes can be helpful to disperse swelling. massage the muscle, they are taken over from the ligament to stabilize the joint for temporary relaxation. When the joint has healed, reawaken it through gentle movements. Massage other area of the body that are being overused to compensate. For example, the other leg if there is an ankle sprain. And third one is bursitis. Inflammation of the bursa through pressure, friction or injury leading to pain that is aggravated by movements. For example, prolonged kneeling can lead to housemate knee. When the condition is acute, massage is only a local contraindication. In the non-acute phase, massage of the surrounding muscles and passive movements within a comfortable range are useful. Massage on the other body area that are being overused in compensation is also helpful. And here comes the skeletal system diseases. First one we have osteoporosis, that is brittle bones. It is fairly common in elderly people, particularly women after menopause. The calcium content of the bone reduces and the bones become soft and crumbly and liable to break easily on sudden impact, especially the wrists and hips. There may be chronic back pain, and in the advanced stage, the vertebra may collapse. Do not massage over the non-osteoporotic area. Massage should be gentle with no stretch, joint manipulations or use of percussive strokes. The main intention is to help the patient relax. Negotiate comfortable position and use of supports with the patient. Take particular care in getting the patient on and off the table. Be cautious when massaging an older patient, particularly women, as they may unknowingly have osteoporosis. Feel the weight carefully as we increase the pressure of the massage. And second one, we have osteomalacia. A softening of the bones in the absence of vitamin D. The bones soften and swells. And third one, rickets. The childhood variety of osteomalacia. In those cases, gentle massage for the relief of symptoms should only be done under doctor's supervision. And fourth one, we have Paget's disease. A fairly rare disease where bone is replaced by fibrous tissue that then becomes hard and brittle with much pain. Bones most commonly affected are the skull, spine and leg bones. Gentle massage for the relief of symptoms should only be done under doctor's supervision. In third one, we have joint problems. The term arthritis and rheumatism are often used interchangeable in everyday language. Arthritis means inflammation of the joint with pain, stiffness and loss of movement. Rheumatism usually refers to aches or pains that come from muscle, tendons or ligaments. There are many varieties of arthritis. It can arise from other conditions. First one, you have osteoarthritis. Wear and tear of the joint, especially the weight-bearing joint, most commonly hips and knees. Hyaline cartilage thins and is worn away, cracks appear and bony growth can develop so that bone rubs on bones. Joints are stiff, often with pain, swelling and sometimes inflammation. Local massage and movement is contraindicated in the acute phases. At other times, massage can be beneficial in providing some pain relief. Gentle mobilization of the joints may prevent further deterioration, provided extra care is taken around painful joints. And the second one is rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease which can cause inflammation of many parts of the body, for example, skin, lungs, eyes and internal organs, as well as joints. Not necessarily constant, it can flare up and then die down. Most commonly affects the hand and feet and sometimes the neck. The synovial membrane of the joint is inflamed, the fluid builds up and the joint swells. If it progresses, the cartilage and bones are affected, the joint may be deformed and or fused together. Massage and movements is contraindicated in acute stage. In non-acute phase, gentle massage of the tissue around the joint may help relieve pain. Careful movements of joint can be used to increase mobility. Stretch or manipulations of the spines are contraindicated, particularly in the cervical region. General massage may help reduce stress, a factor in the flaring up of the disease. The third one we have ankylosing spondylitis, an inherited autoimmune disease that mostly affects men in their mid-teens to mid-30s, in which section of the spine gradually fuse together. It commonly starts as low back pain and stiffness, especially around the sacrum. It may stay there or progress up to the spine and occasionally affects joint outside the spine. It can flare up at times and there may also be inflammation of the lungs, heart, eyes and other organs. In acute phase, massage is contraindicated in area of pain and inflammation. Massage in the early stage can help maintain some mobility. Be careful about putting pressure on muscles near the spine as they may be involved in protective splinting of the vulnerable area. If the whole spine has fused, massage can help relax the spinal muscles. So here comes the muscular system diseases, that is overuse problems. In first one we have muscle overuse. Often painful, can cause stiffness and reduce circulation. It can range from minor temporary stiffness or strain to the chronic and incapacitating repetitive strain injuries. Do not massage muscle if you suspect injury such as bruising and tearing of the muscle fibers. If there are no injuries, massage is helpful on overuse or overworked muscles. Massage the other limb or other area of the body which may be working harder than usual to compensate for the loss of function. Note that muscles can also tighten to protect injuries. If we are concerned that this might be the case, don't apply pressure and be careful when doing passive movements. In second one we have spasm and cramp. They are involuntary contraction of the muscle, usually accompanied by pain. Cramps are short-lived acute contraction which occur most commonly in the calf muscles. Spasms are low-grade, long-lasting conditions. They are commonly caused by lack of oxygen to the muscles, either through overworking the muscle or because of chronic tension in the muscle that is impeding the blood supply. It can also be due to lack of calcium or magnesium. Massage is contraindicated for acute cramp. Stress the muscle to relieve the cramp. When the cramp has reduced, massage can help the muscle to relax. Regular massage and stretching exercise can reduce long-term spasm. So the third one is strain, that is pull muscle. This is stretching or tearing of muscles fibers due to sudden force. It can range from just stretching through a few torn muscle fiber with perhaps a little bleeding to major tearing of the muscle tissue with considerable bleeding, or even complete rupture of the muscle and or tendon, most commonly the Achilles tendon. Minor tears may give rise to scar tissue. Major tear can cause pain and need hospital treatment. Do not attempt to massage acute injuries, for example, bruising, or if you suspect that there may be bruising. Massage of mild strain may be beneficial after 48 hours to improve circulation. When the injury has healed, massage and stretching are beneficial. The fourth one is tendonitis. The result of a strain that can occur in a tendon, often at the junction with the muscle or with the periosteum. This gives rise to inflammation, pain, and stiffness. In this case, massage should not be done in the acute stage, but is helpful when time has passed. The fifth one, we have inflammatory condition. In this we have first one, frozen shoulder. Frozen shoulder involves painful damage to the muscles and the ligaments that stabilize shoulder joints, and the consequent instinctive restriction of movement in the joint. Second one, we have deltoid bursitis. Inflammation of the bursa beneath the deltoid muscle, which happen most often in tennis player and gymnast. Third one, we have housemaid knee. Refers to the inflammation of any of the bursa near to the knee joint. Fourth one, we have tennis elbow. Tendonitis of the muscles of the back of the forearm and their insertion caused by excessive hammering or swaying type movements or a tense, awkward grip of the tennis racket. The fifth one, we have Achilles tendon injuries, most common in runners. The Achilles tendon is susceptible to strain, and the insertion with the calcaneus is a bursa that can become inflamed. Do not massage directly on area of painful inflammation. Massage of the surrounding muscles may help relieve pain and prevent immobilization if the joint is involved. The sixth one, we have blood vessel disorders. In first one, we have deep vein thrombosis, which is commonly known as DVT. A much more serious condition where a blood clot forms in a vein, often when sometimes has to stay in bed after surgery, a stroke, or childbirth. If the clot breaks loose, it can travel through the system to the lungs with fatal result. Massage is totally contraindicated for 3 to 6 months after diagnosis. 4. Client practitioner protection. And second one, we have varicose pain. Usually in the legs are the result of valve failure in the veins and accumulation of the pocket of bloods. The vein walls being thin, stretch and become flabby. Massage is contraindicated in the area directly over or immediately below the vein. The affected area can be held gently while the rest of the leg is massaged. So here comes the conclusion of today's topic. It is essential for the practitioner to have a working knowledge of anatomy and physiology in order to understand and review any pathology prevalence in the patient. Each person needs to be assessed and the principle of the contraindication apply to ascertain if massage would do any harm. It is important to give consistent and comprehensive guidance in relation to contraindication to first one, promote the professional image of the institute by providing consistent information to the patient. Second one, protect patient by ensuring a consistent and safe approach of practitioner. Third one, to ensure that treatment is not unnecessarily refused by practitioner.